you suffer from palpitations, chest pains, fatigue, or anxiety attacks? You may have a heart condition common to millions of women and many men, mitral valve prolapse syndrome.
What do you think was different about the Florida Institute of Cardiovascular Care that didn't, I guess, offer with the other cardiologists that led to your diagnosis?
They just found out what was wrong, basically. You know, I went through similar tests here, and they found the mitral valve prolapse, and I think just putting a name to what I had was 50% of the cure for me, because now I know what's wrong, and I'm not going crazy, because I thought I was. I was having all these symptoms and telling everybody, and nobody was believing me. So now I have a name to it, and I know that I'm in control of how I feel. You know, through the center they gave me like a lifestyle modification, you know, exercise and fluid volume, you know, drinking water and stress management and stuff. And by doing all of that, I feel a whole lot better.
I guess my last question then is, what would your advice be to people who may be suffering from these symptoms and are being told, as you were, that it's all in your head and go home and take this medicine and you'll be fine?
Don't give up. You know, just keep, you know, going. I had gone through, like I said, 3 cardiologists, and then Dr. Sofer's the fourth one, and I just kept going until I found an answer.
Hi, I'm Rosalie Archer. Our lives are full of stress on a daily basis, and for some of us, it is amplified by mitral valve prolapse, a condition that some patients search through doctor after doctor to find the answers to this medical problem and never do. We have Dr. Ariel Sofer here. Thank you so much for coming back, Dr. Sofer.
My pleasure, Rosalie.
Explain to us, what is mitral valve prolapse?
It's a good question. It is when they close, sometimes they don't close correctly. And that inappropriate kind of closing causes a prolapse. That prolapse is called mitral valve prolapse, and that causes a whole host of problems in millions of people worldwide.
And is there a distinction now if you can have this, from what I understand, and it's called a syndrome, but you can also have the symptoms?
Exactly. That causes a lot of confusion amongst many doctors, not to mention the lay public. Mitral valve prolapse, and this was recently shown in the New England Journal of Medicine, is a disorder that is all across the world in all walks of life. Mitral valve prolapse syndrome means those people that have the funny closing of the valve that actually have symptoms from it. They can actually feel it for a variety of reasons. And that becomes a whole syndrome, this mitral valve prolapse syndrome, where they have things from palpitations, anxiety sometimes, chest pain, breathlessness. They can't catch their breath occasionally. Sometimes they have irritable stomachs. There are a variety of these complaints that go with this disorder that's internal. And we've called it mitral valve prolapse syndrome, and it's now getting a lot of recognition and a lot of treatment.
And so how do you detect this?
The detection is difficult. There are millions of people walking around that have it and don't know that they have it. The major way to detect it is to go to a cardiologist or, for that matter, a doctor that has seen it in the past and is able to detect it first by history and then by a stethoscope. And then if not the stethoscope, then an echocardiogram can be used, an ultrasound that we put, like as you put on for babies, you put it on the heart, and you can actually see the heart. And that is the most definitive way. That's why we're able to diagnose it and treat it so much these days, as these echocardiograms are available in most cardiologists' office.
And so we have a picture of that we're going to cut to, but can you explain how that picture works for you?
Absolutely.
And how you as a cardiologist would know that someone had this syndrome?
Yeah, it would be my pleasure. The picture that we're looking at is a picture of a heart that I actually put in a scope that goes down someone's mouth into the back area of their heart, and in there, this, by the way, is not the one that is normally done. This is a very intensive picture when we really have a problem. But in this case, we see the back of the heart in magnificent detail, and you can probably see on the screen now the opening and closing of the valve. Now that valve, as you can see, doesn't close just perfectly. It should close together. It doesn't close perfectly. This is a patient with mitral valve.
There's a separation in between.
There's a separation and a bulging, almost a parachuting. And that little separation and bulging causes the patient to have symptoms. And in this case, We can also see a back leak of blood going back, which can cause a lot of frightful things to happen.
Okay. Now, is it true that the majority of patients with mitral valve prolapse have no symptoms?
Yeah, well, the mitral valve prolapse by itself doesn't have to cause you symptoms. It can be completely silent, but a lot of people do find in life, as life progresses, that they do start to get symptoms, which a lot of times they didn't know was attributable to their mitral valve. Certain things like an occasional palpitation or an oversensitivity to anxiety, a breathlessness, sometimes where you can't catch your breath, an inability sometimes to even just deal with stress, can all be part of this syndrome. So yes, a lot of people don't have symptoms, but as they get older, they oftentimes do get them.
So how does a patient know if they have the problem, if they have the symptoms but are not too sure of if they have this condition?
Well, again, a good question. The doctor that hears it on a stethoscope can tell patient, okay, you have mitral valve prolapse. That person may not have symptoms at that time, and a doctor may never detect it on a stethoscope, yet the patient may have the symptoms, and they need to go see a cardiologist to have that diagnosed or not diagnosed. It's comforting both ways. Comforting for a patient to know that they have it, and that's why they're feeling these symptoms, and it's not in their head, or they don't have it, and they have to really work and find out if they have an anxiety problem or some psychological or other disorder.
Do sometimes cardiologists or even general practitioners just refer to it as a heart murmur?
Yes, it's often just referred to as a heart murmur.
But it's basically a heart murmur is mitral valve prolapse?
Well, this is a type of heart murmur. There are murmurs that are not prolapse. There are murmurs that are completely different. This is a type of heart murmur.
Okay. Now, my understanding is that if you just have the symptoms, which are asymptomatic, but you don't have the syndrome, because like you said, there is a distinction. They'll tell the patients to take antibiotics prior to some kind of surgical procedure or dental cleaning.
Yeah, one thing that we've found, and we've followed lots of people over, many years, we found that these people tend to be more susceptible to infection. And when you go to a dentist, even for cleaning, you introduce microbacteria into the bloodstream. Because you have that leaky valve, well, those microbacteria like to kind of hang on to that leaky valve. And if so, they can cause a heart infection that can be deadly. So we're very, very concerned about those people, and that's why it's important to listen to patients' history to see if they have the symptoms and to treat them before they go to the dentist with some simple antibiotics.
Okay. When we come back, we're going to come with a woman that will be introduced by Dr. Silver that feels that Dr. Silver finally diagnosed her correctly. We'll be right back, and we'll introduce you to George.